Infertility is one of the most emotionally and physically challenging conditions for millions of women around the world. But what if science could offer a way to reverse some of the biological clock? Enter ovarian rejuvenation, a cutting-edge procedure that's reshaping how we think about female fertility, menopause, and aging. Ovarian rejuvenation is an innovative fertility treatment designed to stimulate dormant or aging ovaries to begin producing eggs again. The goal is to restore ovarian function, especially in women who have a low ovarian reserve, premature ovarian failure, or age-related fertility decline. This procedure doesn't just aim to support fertility, it also has potential applications in delaying menopause symptoms, hormonal restoration, and even regenerative medicine. Ovarian rejuvenation is still considered experimental but is particularly appealing to women in the following categories: women aged 35-50 struggling with infertility, women with premature ovarian insufficiency, POI, women with low ovarian reserve, for example, low AMH, high FSH, women who want to delay menopause or improve hormonal health, women who do not respond well to IVF or egg stimulation treatments. It's not typically recommended for women with fully depleted ovarian tissue, for example, complete menopause over several years, although this is still being studied. How does ovarian rejuvenation work? The procedure typically uses one of the following technologies. 1. PRP, platelet-rich plasma, ovarian injection, the most widely used method today. Blood is drawn from the patient, and PRP, a concentration of growth factors from the blood, is extracted using centrifugation. This PRP is then injected directly into the ovaries via ultrasound-guided needle. These growth factors signal the ovary to repair tissue, activate stem cells, and promote follicle development. 2. Stem cell ovarian therapy. This method involves harvesting stem cells from bone marrow or fat tissue, then injecting them into the ovary. Stem cells can differentiate into various cell types and help regenerate ovarian tissue. 3. Ovarian laser or acoustic wave therapy. Still experimental, these techniques use low-level laser therapy, LLT, or pulsed acoustic waves to stimulate blood flow, reduce inflammation, and activate dormant ovarian cells. Scientific background: what the research shows. Research on ovarian rejuvenation is ongoing but shows promising results. PRP studies. Early trials suggest that up to 30 to 40% of women treated with intra-ovarian PRP show a return of menstruation, improved hormone levels, and sometimes even natural conception. Follicular activation. Animal models and small human trials indicate that PRP and stem cell therapies can activate dormant follicles, even in ovaries once thought to be non-functional. Safety and side effects. So far, reported complications are minimal as the treatments use autologous, self-derived materials, reducing risk of immune reaction or infection. However, long-term efficacy, success rates, and large-scale safety studies are still lacking. It's essential to recognize that this is not a guaranteed fertility cure, and not all patients respond. The procedure, step by step. If you're considering ovarian rejuvenation, here's what typically happens. Pre-treatment evaluation includes blood work, AMH, FSH, estradiol, ultrasound, and fertility history. Blood draw or stem cell. Harvesting, a simple outpatient process under local anesthesia. Processing, PRP is prepared using a centrifuge. Stem cells may require lab processing. Injection into ovaries. Guided by transvaginal ultrasound, the substance is carefully injected into the ovarian cortex. Post-treatment monitoring, hormonal profiles are tracked over weeks, months, and ultrasound may be repeated to look for new follicle growth. Recovery and expectations. Recovery time, minimal downtime. Most women return to normal activity within 24 hours. First signs of response. Hormonal changes or follicle growth may appear within 2-3 months. Fertility treatment. Follow-up. Many women pair this with IVF cycles once follicles reappear. Realistic expectations are key. Not everyone will regain full fertility, but hormonal balance, improved egg quality, or even restored cycles may be considered a success. Risks and limitations. Despite its exciting potential, ovarian rejuvenation comes with caveats. Not FDA approved as standard therapy. Lack of large-scale clinical trials, varied patient response, false hope for women with complete ovarian failure. Always work with a reproductive endocrinologist who is transparent about risks, expected outcomes, and scientific limitations. Ethical and social considerations. The ability to reverse aspects of reproductive aging raises ethical questions. Should menopause be delayed artificially? How late is too late to have a child? Could these therapies exacerbate social pressures on women to delay motherhood? As reproductive longevity becomes increasingly medicalized, society will need to balance scientific capability with thoughtful, inclusive dialogue. Cost and accessibility. Currently, ovarian rejuvenation is offered mostly at private fertility clinics and is considered elective. PRP, ovarian rejuvenation costs between $3,000 to $8,000 per session. Stem cell therapy costs between $10,000 to $20,000, depending on complexity. Not typically covered by insurance, limited availability worldwide, mainly in US, Greece, Spain, Turkey, Japan. Some women may require multiple sessions for optimal results. The future of ovarian rejuvenation. The field is rapidly evolving. Research into genetic reprogramming, artificial ovaries, and nanoparticle delivery is underway. In the near future, ovarian rejuvenation may become part of mainstream fertility care, especially if combined with artificial intelligence for follicle tracking, personalized hormonal therapy, bioengineered scaffolds for ovarian tissue repair. Final thoughts. Ovarian rejuvenation offers hope and scientific intrigue, but it's still in its early stages. For women with few fertility options left, it represents an empowering avenue to explore, but with caution, informed decision-making, and a clear understanding of the science. Whether you're considering treatment, supporting someone who is, or just curious about how far reproductive science has come, one thing is clear: the future of fertility is being rewritten, and it starts at the cellular level.